Vitiligo. What is vitiligo? Vitiligo is an autoimmune disease of the skin that targets pigment-producing melanocytes and results in patches of depigmentation that are visible as white spots. This condition is thought to affect 0.5% to 2% of the world's population. A distinguishing feature is a completely amelanotic, non-scaly, chalky white macule with clear borders. Where is vitiligo seen on physical exam? It can be present on any part of the body. However, it is mostly present around the eyes, mouth, elbows, genitals, hands, and feet. It can also depigment hair in or around those areas, including eyelashes, eyebrows, beards, any facial hair, and pubic hair. What causes vitiligo? The understanding of the etiology of vitiligo has advanced significantly in recent years. It is now categorically recognized as an autoimmune disorder associated with metabolism and oxidative stress, including cellular detaching diseases as well as hereditary and environmental factors. There have been numerous studies that have found links between vitiligo and autoimmune diseases such as thyroid, alopecia, rheumatoid arthritis, adult onset diabetes, Addison's disease, pernicious anemia, systemic lupus, psoriasis, and atopic dermatitis. How to diagnose vitiligo? The physical presence of developed amelanotic, non-scaly, chalky white macules with transparent edges is a characteristic dispersion in the mouth, tips of the lower extremity, genitalia, and segment and sites of friction usually yield identification of vitiligo on physical exam. This is enough to diagnose vitiligo. Chemical testing and skin biopsies are not necessary for any identification. A Woods lamp is useful in helping identify the diagnosis in someone with light-colored skin. Under the Woods lamp, the spots glow bright blue/white and have distinct borders. This aids in the destruction of localized melanocytes and detects regions of depigmentation that may not be visible to the human eye. Treatments for vitiligo vary from patient to patient. They can use local and oral immunosuppressive agents, phototherapy, topical corticosteroids, which include potent betamethasone valerate and very potent clobetasol propionate. Laser therapies also use microdermabrasion, microneedling, systemic corticosteroids. It seems though in studies recently performed in 2021, combination therapies had the most repigmentation rates compared to single therapies. Another therapy that is mostly used for extensive refractory vitiligo that affects over 50% of the surface area is called depigmentation. This therapy involves the application of something called monobenzyl ether. It's applied daily for a month. The dose is then increased the next month and applied twice a day. And the application can then be tripled the month after, depending on if positive results are obtained. This can take anywhere from 3 to 6 months for depigmentation. The most important thing to remember is that therapy should be individualized. No known treatment can consistently produce repigmentation on all patients. Always take into consideration the side effects of the drugs / treatments that are available, and treatment can be very discouraging at times, so be patient with your patient.